hear this coming?
No over
Yeah,
under the day. Okay.
yeah, those 2 seats are gonna be empty because that's Alan.
Well, I'd like to call this meeting to order at 1:10. Apologize for our tardiness. I'd like to call to order the September 1st, 2026 meeting of the Board of Regents. Please call the roll.
Regent Rye.
Here.
Regent Darrow. Regent Schneider.
Here.
Regent Oltmans.
Here.
Regent Clare. Regent Kenny.
Yes.
Regent Makovica.
Yes.
Regent Schaefer.
Here.
Regent Shear.
Here.
Regent Stark.
Here.
Regent Whites.
Here.
Regent Wilmot.
Here.
We have a quorum present.
Thank you. For all in attendance, please note the compliance with the Nebraska Open Meetings Act. The board has posted a copy near the entrance of the boardroom. What's that? Your materials have also copies of the minutes from the board meeting held August 13th, 2026. I'd entertain a motion for approval.
Mr. Chair, could we have the pledge, please?
I forgot that. Where was that at? Wasn't in my notes, Kathy.
Well, I'm here with your note.
Is it?
Right there.
Oh, geez. Good job.
Allegiance to the flag of the United States.
The United States of America.
Republic for which it stands, one nation, under
Nation.
God, indivisible, with
Mutual.
liberty and justice for all.
Justice for all.
111, and I've apologized twice.
And we started at 1:10.
That's true.
Let the minutes reflect.
Motion to approve.
So moved.
Second.
Any additions or corrections? Roll call, please.
Regent Schneider.
Yes.
Regent Oltmans.
Yes.
Regent Rye.
Yes.
Regent Kenny.
Yes.
Regent Makovica.
Yes.
Regent Schaefer.
Yes.
Regent Shear.
Yes.
Regent Stark.
Yes.
Regent Whites.
Yes.
Regent Wilmot.
Yes.
Regent Clare.
Yes.
Motion passes.
Thank you. Members of the public were notified that they must contact the corporate secretary with a notice of their intent to speak on an item not on the board's agenda. Each individual will have 3 minutes in which to address the board. We were contacted by one individual wishing to speak on a topic not on today's agenda. Would so please come up? You have 3 minutes.
All right, good afternoon, members of the Board of Regents and President Gold. My name is Sandy Shao. I've been part of the University of Nebraska for more than a decade, first as a student and then as an employee, and I'm really proud of my work here. I'm speaking today because I care about this university, and I believe strong institution depends on people being able to raise concerns and trust that those concerns will be reviewed fairly. So last year, while my son was enrolled at the formal UMC daycare, a staff member created extensive notes about me. The notes include personal information obtained during a private babysitting session were inaccurate and unrelated to my son's care or daycare operations. And it was shared with another party without my knowledge. And I did not know exist until much later. That creation, retention, and disclosure raised seriously privacy concern. As an unmarried mom, I was especially vulnerable to those consequences of inaccurate record created and shared without my knowledge. Because I trusted the university process, I report my concern through Epic Point multiple times. I hope for a meaningful review and a clear explanation of how those records were created, accessed, and disclosed. Although the daycare director apologized to me, my multiple Ethic Point report did not lead to a meaningful investigation. An HR director characterized the note, which include a statement saying I'm hostile, as a failed CPS report. I was also told by the HR director in multiple emails that all my requested document has been provided to me, but I received none of them. This raised a broader governance concern. When employees believe their concern will be dismissed rather than fairly reviewed, they may be reluctant to speak up. I respectfully ask the board to examine whether ethic points should be served as a primary reporting channel without an appeal mechanism, allowing one process to control the intake, review, and closure of a complaint create a single point of failure. I also asked the office responsible for overseeing the formal daycare to consider refunding the daycare fee I paid, while staff conduct and the administrative failure prevented me from using the service safely. The university HR should help employees, not burden them with stress, expenses, and unresolved problems. Thank you for your time and consideration. Have a good rest of the afternoon.
Thank you. Standing rules further provide that anyone desiring to speak on a concerning topic on the agenda may do so, regardless of notice. Is there anyone that would like to address the board? Governor?
Thank you, Chairman Kenny. Thank you, members of the board, for the opportunity to visit briefly. First off, a gigantic thank you to everybody that serves around the table. I have a rough idea what it takes, and the commitment and resolve. I think we're all guilty. We love this place. We love Nebraska. We love the people in Nebraska. I made the statement this morning to some folks out in Grand Island and said, I simply wish, as having the privilege to be your governor, that every Nebraskan could be with me everywhere I go, every day, all day. Because I'm around nothing but extraordinary people every step of the way who are working tirelessly to make things better for the state and the people in Nebraska. I say it all the time. What do we love the most about Nebraska? It's the people. The people are incredible. I think the other thing that's really important on this is that we all have deep convictions. And I know this much while I served on the board. I didn't agree. I didn't agree with everything that took place. But in the end, go forward and say, okay, I might see it differently on this subject or that subject. My ask would be for everybody to recognize how incredibly important it is that we all go forward as a team together. I believe this. I believe we have incredible people in the community. When I was in Gunderson Ranch last week, a rancher came up to me and said, Jim, I have ranch land in X states. There's no place like Nebraska. Because of our people, because of our land, because of our water, the resources that and the value that can be created here in Nebraska is second to none. And I think that what's really, really important is that as we make decisions, that we have an extraordinary appreciation for the people, and what has had an incredible impact is the philanthropy of the people in Nebraska. There's been tremendous wealth created. A lot of people don't want anybody to know about it. And I think that in this decision, it's a really important piece of thinking about our philanthropic community. I was on the board when this process started in 13 or 14 and got asked to serve on the committee. I think that having philanthropic community a part of our Nebraska Medicine UNMC has had an extraordinary historic success. I could be off with this, but in my 10 years serving on the board, I think we signed program statements close to $1.8 billion. Virtually all philanthropic dollars. And a lot of those things just came on handshakes. So my last comment is really simple. It's incredibly important that we do our fiduciary duty, but when we're talking about these kinds of projects, not everything makes sense like black and white in business. It takes incredible partnership. It takes incredible trust. And I've been behind the board on every decision that went. Today it's different. Today OCD would be a great partner. They're a great partner across the state in so many directions. They would be a great partner in what I consider one of the most coveted medical institutions between MD Anderson and Mayo Clinic. We can compete with anybody, but we need everybody on the team to do that. I would ask you all to consider voting yes to be full partners with Omaha Community Foundation. Thanks for all you do. Happy to take a question if anybody has one.
Anyone have a question for the governor? Joel,
Okay.
is that a question? No.
Thank you.
All
Thank
right.
you, Governor.
Thank you, Chairman Kenny. Thank you. Thank you.
Speaker Arch?
Thank you. Good afternoon. My name is John Arch. I am the Nebraska State Senator from District 14, representing the cities of Papillion and La Vista in Sarpy County, and I serve as Speaker of the Nebraska Legislature. And thank you for giving me the opportunity to testify today. And this is a very large decision that you are considering, and we all know it's going to impact generations to follow. I'd like to offer two thoughts for consideration. First, I'd like to share the perspective of the legislature. When the plan to buy out Clarkson was announced, it obviously created a stir. The conversation surrounding the plan focused on the issuing of debt to finance the buyout of the partner. The concerning element of that was that Project Health was as of yet unfinished in the financing of the total project, and that this could require additional debt financing to complete. It was an unknown. It was concerning enough that a bill was introduced and heard in committee. I would say that the question raised was, surely there must be another way. When the philanthropic community became a possible partner and vehicle to address the buyout without additional debt, the general response was, that makes a lot of sense. As a matter of fact, the phrase I heard was, this should be a no-brainer. I understand there are details in all of this that we are not privy to, but the concept of a qualified partner who could join you resonated to many in the legislature, especially with Project Health looming large in the future. The legislature would view joining with the philanthropic community at this time as a very sensible decision. Second, I would like to share my perspective from my healthcare executive background. One of the challenges of your decision today is that none of us know the future of healthcare. The healthcare industry today is anything but stable or predictable. Technology is producing amazing patient outcomes, but raising costs dramatically with miracle drugs and treatments. We know that healthcare costs are rising in general, challenging all households and employers with their ability to afford insurance premiums, and for the federal government to continue to subsidize costs. We know that politics at the federal level can swing dramatically depending upon who is in office. I can't tell you what the future holds, but I think it is safe to say that tomorrow will not be like today. I believe you have before you today a very sensible way to engage in risk management. A partner is offering to join you in assuming a portion of the risk of an unknown future. This partner has the resources to support uncertainty and the commitment to the venture to do so. Based on these two observations, the diminution of debt and the benefits gained in managing future risk, I would recommend a yes vote on the proposal to partner with the Omaha Community Foundation. Thank you very much for your time.
Thank you, Speaker. Do you have time for a couple questions? Does anyone have any? Thank you.
Thank you.
Mr. Dannon?
Good afternoon. Most of you know me, I hope. I'm Troy Dannon. I've been honored to be the Director of Athletics at Nebraska Lincoln for the last 2.5 years. You know, athletics are often referred to as the front porch of a university. In my experience in Nebraska, it is more the front door than the front porch. As a result, I think the health of athletics has an outsized influence in affecting the health of the university system and the state. Good, bad, right, or wrong. That is just the outsized responsibility that comes with the role of athletics in the state. But in reality, Husker athletics is only enabled through the health of the university system and through the health of the state. And in that respect, we're only enabled to be successful through the relationships, the support, and the partnerships that we have with the philanthropic community. Athletics' short and long-term health and the empowerment of any future successes that we are going to have is determined solely by the people we trust and the people who trust us. The partnership under consideration before you today pairs the two entities that are athletics' most trusted partners, the Board of Regents in leading the university system and the philanthropic community represented by the Omaha Community Foundation. Not here to speak on specifics, as you well know, as an athletic director, that is well outside of my bailiwick. But I'm here to speak as a beneficiary of the synergistic relationship we have with the philanthropic community in this state. I've led departments in 3 states over the past 2 decades. And it is true, and in a lot of contexts, there is no place like Nebraska. With that thought in mind, it is not draconian to remind everyone, and remind them over and over again, that not only does Husker athletics not thrive without our philanthropic community, we do not survive without our philanthropic community. We stand strong because of our relationships, the trust, and the empowerment given to us by those who, with your approval, will work similarly to empower and enhance the university that we all care about. As I close and circle back to my opening statement, the health of intercollegiate athletics is reliant on the health of the university system and reliant on the health of the state. And the state is in turn emboldened, and the university's health is in turn emboldened by the health of its athletic program. In my position as Director of Athletics, I'm excited for the opportunity to have the trust and benefits of our relationships with the philanthropic community extended to the university through the partnership that you're going to consider today. Thank you.
Thank you, Troy. Anyone have any questions for Troy? Thanks, sir.
Thanks.
Would anyone else like an opportunity at the podium? Being no other persons wishing to speak, I now declare the opportunity for public comment closed. I will ask President Gold, excuse me. We have a motion for closed session.
I move the Board of Regents go into closed session as authorized by Section 84-1410 of the revised statutes of Nebraska for the protection of the public interest and to prevent needless injury to the reputation of persons who have not requested a public hearing, for the purpose of holding a discussion limited to the following subject: strategy session with respect to certain real estate purchases and other transaction negotiations.
Second?
Second.
Comments? Roll call.
Regent Schneider?
Yes.
Regent Rye?
Yes.
Regent Oltmans?
Yes.
Regent Makovica?
Yes.
Regent Schaefer?
Yes.
Regent Shear?
Yes.
Regent Stark?
Yes.
Regent Whites?
Yes.
Regent Wilmot?
Yes.
Regent Clare?
Yes.
Regent Kenny? Motion passes. We are in closed session.
Welcome everybody back. Do any of the regents have any additional business you'd like to discuss?
Chair Kenny, I move to read a resolution into the record for the board to consider and adopt via majority vote.
Comments? Okay.
Regent Oltmans,
Yes.
Regent Rye,
Yes.
Regent Schneider,
Yes.
Regent Schaefer,
Yes.
Regent Shear.
I'd just like to make a comment along with my vote. We've had a really good discussion this afternoon. We've had several discussions along the route. And coming down this morning, I had a nice 2-hour drive. You folks that live here or whatever have a 40-minute drive. And to reflect, I wasn't sure how I was going to vote on this. I saw benefits, and anytime you get looking forward, sometimes you want to look in the rearview mirror and see things that necessarily happened. And I think if we're going to be honest, what had happened over the last 12 months is probably maybe a lack of trust on both people that were negotiating. And at some point, we just have to learn to get along. I know in my previous life, I would work with individuals in relationship to some of their legislative items, and they would have a bill, and it would have A, B, and C, and D in it. And I'd say, gee, you're not going to get this passed. No one likes D. Yeah, why don't you just eject D, amend it off, and you're probably going to get somewhere. And they'd look at me and say, no, I got to have everything. I said, but you're not looking at it correctly. You can have everything or you can have nothing. Because one or the other is going to happen, and I can tell you right now, it's going to be nothing. And too many times I saw good legislation that had 1 or 2 flaws in it not make it across the line because of those 2 flaws, and a person was not willing to amend that off for the better good of the state, because most bills improve the state. What we have in front of us is a monumental opportunity for not only the university, but the state. It is going to be truly a gigantic boom for the Omaha metro area. I mean, if we're going to be honest, that's where the facility is going to be, and that's where a great deal of the population growth is going to be. But it is with ag, is the dollar maker for the state of Nebraska, and it's funding for all the services that the state provides. And the state provides, Healthy provides funds for the university. I'm looking forward to having that relationship. I'm looking forward to hopefully at some point in time not having to worry about if somebody, it's not what they said, but maybe how they said it. I know my wife and I always get in an argument because, geez, what did you say that for? What did I say? And I said, well, I'd say that. She goes, I didn't say it like that. And I said, well, that's what you said. And she goes, no, that's not what I meant. And too often we continue to go back and look at things with a different perspective than what they were meant. I think we have a wonderful opportunity. I am not at all convinced that we couldn't have had a complete opportunity for a complete vote on a total package. But what we have is what we have, and what we can move forward, and perhaps those in the future will be much easier than those in the past. I want to thank Rob, because Rob and I have maybe been more concerned than others, because this is sort of our baby. We got a call literally 2 years ago this August by a couple folks at Clarkson wanting to talk about divesting themselves. And, you know, we got a lot of flack because we met in secret in places I didn't know existed for literally almost a year and a half. And that was their choice. We didn't get to say, well, we want to tell the world what we're doing. We had to agree to what they wanted to do, and we did that. And unfortunately, it caught some people off guard, which caused problems then in certain areas, in certain folks' opinion. Not intentional, but it doesn't matter, it still happened. So I'm just hoping that as we move forward, everything becomes the rear view, and we start looking through the front view. I know on my way out of town, I'm going to stop and get some gas, and I'm going to wash off the windshield. And we're all going to see things clearer. And we can only imagine what this can bring to the state. And you know, when we talk about the health and Project Health, you know, as I've said before, and I think I've talked to you, Pat, one time, I said, you know, I don't want you to come to Norfolk and do all the appendectomies or tonsil pullers or whatever the hell you call it now. I mean, I remember being 4 years old, and my mom, I had two brothers and a sister, and we marched in and had one room at the hospital, and the doctor said, well, you might as well get them out, and plump, 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 we all had them out the same day. Not one of us was sick, we just had them out. But we put a lot of effort in this, and we took a lot of pride, and it is going to reach fruition. We do have, I think, a high quality, and what I continue to hear was a trusted partner, and I believe that. So that as we move in the future, you know, it's time that we don't talk about the future. The future is today, and it's an exciting day, not only for the university, but for the state of Nebraska and the health of Nebraskans. That facility in Omaha is the epitome of what 99% of the states would love to have. When I get a call pretty frequently, because people will call and say, gosh, Aunt Agnes or my little child or whatever the case might be has a problem. What do you think? I said, I think you need to go down to Omaha. Because maybe they can't fix it, but they sure as hell will know where to send you to get it fixed. Unfortunately, right now, there's still a lot of things that we can't fix. We can just prolong. And with the research that this would be able to provide the state of Nebraska, those no longer able to fix or repair will become things of the past. And I'm very optimistic about the future and look forward. And with that, I would say yes.
Regent Stark?
Yes.
Regent Whites?
Yes.
Regent Wilmot?
Well, I guess I won't write a book like Jim did.
I haven't said a thing all day.
Neither have I. But I will make a few comments, because I'm going to be honest, I've had some concerns as we work through all of this, because I'm a person, I guess maybe from working 20 plus years in the prison system, I know that facts mean something. They're important. And so for me, my qualms have been the lack of details in the documents that we're considering. In the prison system, you never say, just trust me. So that's been a catch, and probably from my occupational experience, that has always bothered me. So this is going to be a stretch for me to trust because of all the details that aren't in the documents, but I've been assured by everyone that's been involved in this much longer than I have that we're working with very trustworthy partners that truly want to see this go forward, want to see Nebraska be better, want to see more opportunities for our students and for our future. So I'm going to be watching on behalf of the taxpayers and the students in this state. And but I do believe that with the amount of details we're talking about, there is a lot of opportunity to be had. And that's something that in this day and age, sometimes there's just not a lot of opportunities out there. So my vote is yes, but I do want to, though, it says in the resolution that we're thanking Dr. Gold and Dr. Davies, and I agree, they did a lot of work. But I'm going to tell you, Regent Shear and Regent, what's your name?
What's his name?
Yeah, they have done lots of work. They have spent an innumerable amount of hours. And of course, we know that they did request their bonus check, but Dr. Gold denied it. So, but I want to thank you guys for.
Well, we'll get
all
our
the work.
$300 million back.
I just want to thank you for all the work you did.
Regent Claire.
Yes.
Regent Kenny. Yes. Regent Makovica.
Yes.
Motion passes.
So now I get to read the resolution.
You do.
Whereas the University of Nebraska system exists to transform lives and save lives in communities in Nebraska and all around the world. And whereas the University of Nebraska is committed to assist with the current and projected healthcare workforce needs to increase the educational pipeline of the future health professionals, the future health professions workforce to support the increasing demands of communities of rural and urban Nebraska. And whereas the growth of the health professions workforce depends upon long-standing clinical partnerships across the 500-mile campus of UNMC, including the key governance of Nebraska medicine. And whereas after public notification of Clarkson Regional Health Services intent to withdraw as a member, certain Nebraska philanthropic organizations represented by the Omaha Community Foundation, the Walter Scott Family Foundation, and the University of Nebraska Foundation, herein the organizations, graciously expressed their interest to the Board of Regents of the University of Nebraska, herein the board, of their desire to work collaboratively with the university to ensure Nebraska medicine continues to excel as a world leader of health professions education, research, and in providing extraordinary patient care. And whereas CRHS, I'm sorry, that was Clarkson Regional Health Services, CRHS officially withdrew as a member of Nebraska Medicine, making the board the sole governing member of Nebraska Medicine on June 30, 2026. And whereas the board and organizations began a series of negotiations on what such a collaboration would entail, including providing contributions in the governance of Nebraska Medicine and the potential for the Omaha Community Foundation, herein OCF, being added as a second governing member of the Nebraska Medicine. And whereas the board unanimously passed a resolution affirming this approach and establishing a temporary shared governance structure for Nebraska Medicine that included representatives of the organizations on June 19, 2026, and subsequently unanimously passed a set of amended and restated articles and bylaws on June 26, 2026, providing for a defined period of shared governance beginning July 1, 2026. And whereas the articles defining this shared governance structure were filed with the Nebraska Secretary of State on July 1, 2026, with weekly meetings of newly designated Nebraska Medicine board members representing both the board and organizations beginning thereafter. And whereas after extensive work between the organizations and the board designated representatives, the parties have developed highly detailed and near final drafts of key documents, including articles of incorporation, bylaws, a membership assessment agreement, and a membership governance agreement, a membership agreement, herein the definitive agreements, setting the stage for a long-term successful shared governance structure for Nebraska Medicine, into which the OCF will become a member of the Nebraska Medicine in accordance with the terms and conditions of the definitive agreements, herein the proposed transaction. I'm almost done. Whereas the board has reviewed and considered the terms and provisions of the definitive agreements, and prior to this meeting has reviewed and discussed the proposed transaction in committee sessions, including reviewing the most current drafts of the definitive agreements and the steps necessary and appropriate to consummate the proposed transaction by engaging in a page turn of the definitive agreement drafts, and deems the proposed transaction and the definitive agreements advisable and in the best interest of the University of Nebraska, Nebraska Medicine, and the state of Nebraska. Whereas the board wishes to express deep appreciation to Dr. Gold and Chancellor Davies for their tireless efforts and for the organization's generosity and shared commitment to advancing the mission and long-term success of Nebraska Medicine. And as a side, I would also like to add Rob and Jim to the appreciation in addition to President Gold and Chancellor Davies. Whereas the board wishes to affirm its desire to take the next steps in the process towards the Omaha Community Foundation's integrated role within the Nebraska Medicine governance structure, now therefore be it resolved that the Board of Regents of the University of Nebraska hereby commits to little I, number 1, continue to work diligently with the Omaha Community Foundation toward the consummation of the proposed transaction. 2, authorizes the finalization of the necessary regulatory and governance documents related to or required by the proposed transaction. And 3, authorizes and approves the definitive agreements and authorizes and approves the chairman of the Board of Regents of the University of Nebraska, Paul R. Kinney, and any such other officers of the University of Nebraska as appointed by the chairman, the authorized officer, and collectively with any appointees, the authorized officers, are hereby authorized and directed in the name and on behalf of the Regents to pursue, negotiate, finalize, execute, and deliver the definitive agreements consistent with the general terms and conditions that have been presented, summarized, and provided to the Regents prior to this meeting, and to fully negotiate any changes to the definitive agreements consistent with the conversations prior to this meeting and the matters discussed prior to this meeting of the Regents, both in connection with the page turn of the definitive agreements and any other changes, additions, modifications, and amendments to the definitive agreements as such authorized officers shall deem necessary or appropriate. The execution and delivery thereof by such authorized officers to be conclusive evidence of the approval thereof by such authorized officers.
Thank you, Regent Clare.
Thank you.
Is there a motion to adopt a resolution by the board?
Motion.
Second.
Motion been made and second. Any discussion?
Yes.
Yes?
I think this is the biggest vote we'll make in 50 years on this board. I'll show my bias, but I spent my entire career in medicine. I did my postdoc in '72, joined the university, '73, became a tenured faculty member. My 15 years at the Med Center was the best job I ever had in my life. I love teaching, I love doing research, particularly taking care of patients. When you spend as many nights as I spent in intensive care units for pediatrics, neonatal, and you see what happens when there's a passing of an infant, it changes your life. You see how it impacts the families, see how it impacts the faculty, and we are blessed to have an incredible number of faculty. I used to complain about the faculty back in the 80s, but now when I go, I see an international group of specialists that are really hard to come by. I know that there's been some discussion. I see this as Maya Angelou said, people may forget what you say. They may even forget how you said it. They will never, ever forget how you made them feel. Unfortunately, we made the philanthropic community not feel so good. So this is very special for me. All of us on this board have been treated at the Med Center, and I'm particularly appreciative of the governor. In the middle of budget crisis, in the middle of a campaign, to come here and spend most of his day here shows his passion. He also benefited from services at the Med Center. And I've known him for 30 years in the same way with John Arch, who has an extensive 30-plus year background in healthcare also. To have these men, to have the entire governor's office and the legislature supporting this sort of thing, and to know what this means for so many faculty, and particularly for those patients. Who's taking care of the poor and the elderly? We are. We have 1.5 million patient visits, 1.5 million, from Medicaid and Medicare. And who's delivering the services? 1,000 of those docs across the states. And we're going to see more of those hospitals failing, and we're going to be taking care of those patients. And so we're the only Tier 1, Level 1 trauma center in the state, and that's what people want to look forward to, and all of us benefit from that. So my thanks to all the people involved in this, and it's a huge victory. I would appreciate the Omaha Community Foundation, and Dr. Ash for coming here, and the work that has been done by our friends at Kiewit. So I just want to say that this is a monumental day, probably the biggest thing that I did in my 6 years, in addition to seeing 66,000 students graduate, is to watch this med center get built. I know what it's like. My family was treated there, many of them treated there. So I appreciate what's been proposed here, and I appreciate, my vote is going to be very strong, yes.
Any other comments besides Tim?
Yeah, thank you. I've said it before, and I'll say it again. I've had the absolute privilege of a lifetime to serve on this board. During my tenure, we've done some amazing things as a board. The Buffett Cancer Center, the Davis Global Design, Kiewit Hall, Hawks Hall, the Christensen Health Complexes, just to name a few. And not to take anything away from those projects, but this decision before us today is the biggest decision of my career on this board. So first, again, as I mentioned during the resolution, I want to say thanks to Rob and Jim. I think it was 2 years, did you say, that you guys been working on this? For taking the laboring oar. I appreciate the work that you put in on this project, along with your time and expertise in getting the transaction, to this point where we're ready to finalize things. Second, I thank the philanthropic community. Don, I can't see you back there, but I know you're back there. There you are. Thank you for your commitment to the University of Nebraska, to the state of Nebraska, what you have done for higher education generally, and for the university is amazing. And as I said, I've said before, I cannot imagine what the University of Nebraska would be like without your support, the support of the philanthropic community in general. So thank you for everything there. We're incredibly fortunate to be in the position that we're in. I sent around that article yesterday that was in the Wall Street Journal. We are in the catbird seat, and we looked into doing this transaction on our own without the help from anyone, including the philanthropic, and honestly, in large part to the philanthropic community. Again, we wouldn't be where we are. So as an example, with the philanthropic community, 84% of the giving of the top 25 historical donors is from the Omaha philanthropic community. 47% of our $3 billion Only in Nebraska campaign is from Omaha. What's also amazing is the breadth of the giving. 80% of the giving to NCTA for the Student Activity Center is from Omaha. 86% of Kearney, 56% of UNL, 86% to UNMC, and 94% at UNO. 10% of our enrollment is paid. I guess it's 11. Barb corrected me earlier. It's 11% of our enrollment is funded by the Omaha Philanthropic. So we're incredibly grateful for your support, and look forward to this partnership with you going down the road. And again, as I've said before, this project is one thing. I'm looking forward to changing the world. So I'll be voting yes.
Amen.
I just want everyone to know that Tim wrote that sermon quite a while ago, and he's delivered it about 16 times.
And it's finally catching.
And the offering plate keeps coming up empty.
Not this time.
Anyone else?
I just wanted to share a personal story. So I volunteered at Nebraska Medicine, and part of my role was to just wheel patients around. And there are two patients I remember. One of them drove 6 hours because Nebraska Medicine provided the only service for the treatment they needed. Another patient drove 3 hours because they trusted Nebraska Medicine that much. And it goes to show how powerful and how impactful Nebraska Medicine is in people's life. And so I'm grateful to everyone who was involved in this partnership. Thank you so much for bringing this to the table. I truly can't wait to see, both as a person living in Nebraska and as a pre-med student, to see what the value and the impact Project Health will have on us.
Thank you.
Kelly?
I really want to thank the Regents. I realize that this has been a difficult decision because of your fiduciary responsibility to the state. And I know many of you have wrestled with sleepless nights trying to understand how to make this decision. But I really want to thank you on behalf of all our faculty, our staff, and our students who have been looking forward to today. I think, it's obviously, I also want to thank President Gold. I want to thank Donna Cush, who we've been working with very closely over the last several weeks. The Walter Scott Foundation, all the people who've been involved in this. I've recognized that everybody wants the best. That's something that's always been very clear to me, is everybody wants the best for UNMC Nebraska Medicine. And that's never been in doubt to me. I really would just want to say thank you, because we're entering uncharted waters right now in healthcare. And having a philanthropic community that can come alongside of us and help us navigate this is going to be really, really important to this vital asset to the state of Nebraska. And I think it's not just about ongoing governance and the current, membership ask, but it's also Project Health, which will be the single most important project in the history of Nebraska. And I really believe that this is a project for the state of Nebraska. And as I've gone across the state, meeting with critical access hospital CEOs, they understand the value that Project Health brings to them. And they understand that even though it's in Omaha, that this is something that they can also look forward to partnering in many ways. So really, I want to express gratitude to all of you for just, all the hard work that's gone on. And again, I know that this has been difficult, and I understand why, because I understand the fiduciary responsibility you all hold towards the university. But I really believe that our students, our faculty and staff, and Nebraska Medicine staff as well, are really looking forward to this day. So thank you really to all the Regents, to President Gold, to Donna. Bruce Grucock is not here, for just your incredible tireless work in making this happen.
Well, thank you as well. It's almost exactly 13 years ago today that I got a call from then President J.B. Milligan and asked me to consider taking a position as the Chancellor of UNMC and the Chair of the Board of Nebraska Medicine. And over those years, I will tell you the best decision I ever made in my life was a young lady I proposed to 52 years ago. But the second best decision I ever made was to come here. And I've never regretted that decision, in spite of the fact how difficult the last 2 years has been. I sat at the table with Rob and several others when Clarkson announced that they were going to withdraw, and went through a very difficult process, legalistically as well as emotionally, understanding what that change would bring. And yet today we have an opportunity to put that last 2 years plus into the rearview mirror and to move forward with a partnership that really looms big for all of us. While the documents, the articles, the bylaws, the membership agreement, and things of that nature are all critically important, and that's what Regent Kinney will have an opportunity to execute at some time in the future. It is really the benefit of this partnership that's really going to make a difference, whether it's Project Health or things that we can't even conceive of today. As Deli said, the future of healthcare is really unknown. The waters are turbulent. There are a lot of crosswinds. And going into this with a partner who can help us, who understands and represents the very best of our community. I'd also like to add that we have 4 physician leaders with us here today, and they represent the absolute leadership of the medical group that supports over 99% of the health care delivered by Nebraska Medicine. They are all faculty members and department chairs of the leading departments, and I can tell you they are intimately aware of the details of this opportunity that are before us today. And I don't want to speak for them, but the conversations that I have had have been strongly supportive of moving forward, not because of the legalistic language, but because of the future that we have before us. There is no question that Project Health, not only the largest public-private partnership ever contemplated in the state of Nebraska, not only the largest economic development project, which will bring over 8,000 new high-paying jobs to the state and more than pay for itself from the state contributions in just a short number of years, but more importantly, to underlie and to produce the foundation for the future of the healthcare workforce, healthcare research, and the delivery of serious medicine and extraordinary care. So I'm really thrilled that this day has come, and I'm really pleased that this is going to go to a full vote by our board. I thank you for this opportunity.
Anyone else? Last but not least, guys, I've thanked you guys for your year and a half of negotiating, but no one has thanked you for bringing to this table an unbelievable deal for the state of Nebraska. Unbelievable deal. Thank you. We've heard words of lifetime, monumental, giant words that affect everyone's life, affect Nebraska. And I'm so proud of you guys because no one really lost it. We were close. We did good. Thank you. Vote, please.
Regent Rye,
Yes.
Regent Schneider,
Yes.
Regent Oltmans,
Yes.
Regent Shear,
Yes.
Regent Stark,
Yes.
Regent Whites,
Yes.
Regent Wilmot,
Yes.
Regent Clare,
Yes.
Regent Kenny,
Yes.
Regent Makovica,
Yes.
Regent Schaefer.
Yes.
Motion passes.
Yes.
No further business that anyone would like to bring up? We do have one little deal I'd like to talk to at least some of you on the way out to get your opinions. Not, we need a motion to adjourn.
Second.
All in favor?
Aye.
Adjourned. Thank you.